this is Dr. Jacob Lilly here with another video talking about lower back pain and specifically our motor control and what that exactly means in terms of our lower back pain and what we can do to fix it. But before we get started with that, make sure to like, comment, and subscribe for the video, and we'll get right into it. So first things first, we're going to talk about motor control specifically in this video and what exactly that is and how we are going to improve upon that to help with stability in our spine and thus help with lower back pain. So couple things. What is motor control? Now, motor control is essentially our body's way of recruiting certain muscles to help with contraction, relaxation, stability, movement, anything else that muscles provide in the body. It's our neurological pathway in how we can control that. So oftentimes a lot of people with lower back pain actually have something called motor control deficits. Many people actually do not know that the spine is actually very fragile if there's not muscular tension associated with it. It's actually very easy for the spine to buckle on itself under its own weight and with minimal load applied to it. However, that's obviously not the case, as we as humans can walk, run, and do very much dynamic tasks with the help of this muscular contraction and stability that enhances our spine's ability to tolerate loads. So the one thing we're going to talk about is how the deficit of that can cause lower back pain and what we can do to fix that. Now, as I said, the spine is very easily buckled with minimal pressure or strain on the actual spine itself. It'll buckle and deform, and there will be problems with that. Now, to combat that, we actually have our muscles, which provide tension and thus stability to the system to not allow that buckling to happen. So that very much points to the direction of how important exercise is in terms of spinal stability and what type of exercises we need specifically to enhance stability properly. That way we can decrease our chances and likelihood of having lower back pain. So today we're going to discuss that. So now that we know what motor control is, we can then talk about how motor control can be disturbed and thus cause issues with lower back pain. So for example, if you are sitting for prolonged periods of time, that can have altered neurological input to specific muscles that need to be activated at a certain time, which enhances stability of the spinal segments, okay? So that's just one example. If you are sitting for long times, like many desk workers are, Uber drivers, taxi drivers, things like that, where you're just sitting for prolonged periods of time without any intermittent breaks, that can alter motor control patterns, which can have issues with lower back pain. Another way motor control can be affected is actually through aerobic circumstances. To translate that basically means as we are, let's say, exercising and we are getting fatigued, we're getting tired, there tends to be an altered motor pattern recruitment, which again can lead to lower back incidences. I actually find this to be a more common reason as to why people experience lower back pain, especially when they're in the gym. For example, if they're deadlifting, and usually when you fatigue, number one, form starts to break down. Now, as form starts to break down, that's going to lead to any biomechanical issues to try to compensate for that form breakdown. Now, with that, you're going to get this altered motor recruitment pattern that's also going to arise because of the fatigue. The nervous system can also fatigue and get tired. And when that nervous system starts to fatigue, it can lead to altered outputs into the muscles. We'll have this sort of inadequacy built into it, which will lead to issues with stability and movement and proper form as well. So you can see how these things start to kind of compound on each other. We discussed certain things that can perturb or kind of mess up that motor pattern ability and that ability to control those muscles in a correct fashion. Now we're going to talk about certain things that we can do to help mitigate that or even help reverse that issue, okay? So without pointing out the obvious things, such as if one of the issues is you sitting for long periods of time, a great benefit would be to not do that, essentially. I know in certain instances it can be difficult, but having that mindfulness to break up that monotonous sitting of long periods of time and break up that sitting, go for some stretches, do some exercises, keep that stability present, get those muscles activated, that's going to help more so than the person who's just going to sit through that long period of time without doing anything. Now, we're not going to talk specifically about that because those things tend to be a little bit more obvious. What we're going to talk about today is about specific things that are going to help create that contraction of muscles which are going to enhance stability, as well as retrain yourself to become better at using that motor control patterns and establish those patterns that are going to help with lower back pain. So number one, the first thing we're going to talk about is actually the transverse abdominis muscle as well as the multifidus muscle. Both muscles are extremely important in terms of core stability and lower back pain. Now, it's often been found that with people with lower back pain, they have altered muscle recruitment or an altered motor pattern of recruitment of those muscles when people have lower back pain. So the best way to attack this issue of lower back pain is actually training these muscles. Now, the best way to do this to start is actually with our breathing, okay? There's a specific technique called abdominal hollowing. Now, what that does is essentially, instead of pushing your stomach out into a bracing technique, which we'll go over again in a second, you're actually gonna do the opposite and kind of bring your stomach towards your spine, okay? The best way that I usually recommend this for patients with lower back pain and kind of need this issue kind of addressed is I usually start with them lying on their back, okay? Make sure they're nice and comfortable. Make sure you're nice and comfortable if you're trying to attempt this at home. And the best way to do this is put your hands on your belly. Once your hands on your belly, I want you to suck that belly in. Visual idea I want you to get is get your belly button to touch your spine. When you do that and you activate those muscles, you're actually going to activate the transverse abdominis with that abdominal hollowing. When you start to do this, you might feel a little tension in the deep abdominal muscles. Again, those muscles that we're not going to see in the mirror, but are very much a key role in stability of our lower back. And it's going to help promote the strength and endurance and motor control of that. The best way to start with motor control training is actually the awareness of those muscles. So if you can feel those muscles, chances are you're already improving that motor control of those muscles. Number two, we're going to talk about multifidus training. Another thing to train this muscle specifically is a little change at the end of our abdominal hollowing technique, okay? So the abdominal hollow, you're going to bring that stomach in, you're gonna suck in that belly in, you're gonna bring that belly button straight back towards your spine, and when we're at that end range, I want you to pretend like you're squeezing the last bit of air out of your lungs, okay? You're forcefully trying to push that air out of your lungs at the very last second. If you need help with this tends to be a little bit more difficult. The best way to do it is take a deep breath in, breathe all the way out, and as you're breathing all the way out, I want you to force all that air out until you feel like there's nothing left. And once you feel like there's nothing left, I want you to force that last few breaths out. Push it out, okay? Like you're pushing through a straw, okay? When you do that, and you're forcefully exhaling that air, you're actually going to activate the multifidus muscles, which are these tiny little segmental muscles from segment to segment in our lower back and throughout our spine. And that's gonna help with the proprioception and thus the stability of the spine, okay? Now, when you're training for the multifidus as well as the transverse abdominis, you wanna understand that these are just two muscles that we're targeting. We're isolating these two muscles because sometimes these muscles can play a big role with lower back pain patients, so we train them to try to help with that, okay? But that is not the one size fits all approach, okay? We also want to practice our abdominal bracing technique. The best way to practice this is taking a deep breath in through our diaphragm, really push that diaphragm down, fill that stomach full of air, and then work on the co-contraction of all of our outer, more mirror muscles of the core, you know, the rectus abdominis, the internal, external obliques, and basically use that co-contraction of those muscles to create stiffness in our spine. So now we have two techniques, both are related to breathing. We have the abdominal hollowing technique, which is going to bring that belly inwards, and usually we can accompany this with exhalation of the breath, so breathing out. And then there's the abdominal bracing technique, which is going to increase stability by creating super stiffness in the core, as well as keeping air in the system, which is going to help with that co-contraction of all the muscles of the core. So those are just two techniques that we can utilize to help promote stability and help improve our motor control and motor recruitment of those muscles to help keep our backs healthy and keep ourselves out of pain. Okay, to start, we can just start with abdominal bracing, and we can start with abdominal hollowing. But once we achieve that and we're able to do that on a daily basis, now we can move on up the food chain in terms of our rehab programming and start with other low load bearing exercises for our spine, which are going to help promote that strength and endurance of those muscles. So the first thing is fix the motor control problem, which we're doing with abdominal hollowing and the abdominal bracing. Once we have that motor control problem fixed, then we're going to progress to endurance exercises. Now, this is going to improve the muscular tone and endurance of the core muscles, which is again going to help promote stability in our lower back and thus help with the lower back pain problem. That information is going to be shared in another video, so stay on the lookout for that. Once again, you guys, if you guys made it this far, please like, comment, and subscribe for the video. Take care.